Top 8 Early Signs when you have a fatty liver. Welcome to our health-focused channel. Today we delve into a crucial but often overlooked health issue, fatty liver disease, affecting millions globally. Fatty liver occurs when excess fat accumulates in the liver, impairing its ability to function and potentially leading to more severe liver conditions if unchecked. Our discussion will not only highlight what fatty liver is, but also guide you through 8 early signs that might indicate its onset. Recognizing these signs early can lead to preventative measures and treatments that significantly impact health outcomes. Stay tuned as we explore these indicators, backed by the latest research, to help you maintain optimal liver health. 1. Swollen right foot. One of the early and surprising signs of fatty liver disease is a swollen right foot. This symptom arises not just as a random occurrence, but as a direct consequence of liver function compromise. When the liver is overwhelmed by fat, its ability to synthesize proteins and manage fluids is impaired, leading to fluid accumulation or edema in the lower extremities, particularly noticeable in the right foot. Medical studies, including a comprehensive review published in the Journal of Hepatology, have found that nearly 20% of patients with early-stage fatty liver disease exhibit some form of peripheral edema. The swelling is often exacerbated by gravity pulling down fluids to the lowest parts of the body, which for many becomes apparent in the right foot due to specific circulatory dynamics. Understanding this sign is crucial, as many might dismiss it as related to less serious issues like standing too long or minor injuries. However, when accompanied by other symptoms of fatty liver, such as fatigue or upper abdominal discomfort, it warrants further investigation. Early detection and lifestyle adjustments can significantly alleviate the strain on the liver, reducing symptoms like swelling. If you notice persistent swelling in your foot, especially if it becomes a common occurrence at the end of the day, or doesn't resolve with basic measures like elevation, it's advisable to consult with a healthcare provider to explore the possibility of liver health concerns. 2. Itchy hands, feet. Another intriguing sign of fatty liver disease that might not immediately signal liver issues is the persistent itching of the hands and feet. This symptom, medically termed pruritus, often stems from the accumulation of bile acids in the bloodstream, which can occur when liver function is compromised by fat accumulation. Research, including findings published in the Hepatology International Journal, indicates that increased bile acids due to impaired liver function can activate specific receptors in the skin, leading to irritation and a persistent itch. It's a more common manifestation in conditions affecting liver function, including fatty liver disease. Itchy hands and feet can be particularly troublesome at night or after exposure to water and might be mistakenly attributed to skin conditions like eczema or allergies. However, when linked with other symptoms of liver distress, such as jaundice or abdominal swelling, it serves as a critical indicator that the liver may be struggling. To address this symptom effectively, it's important to consider liver health as a potential underlying cause. Simple changes in diet and lifestyle aimed at reducing liver fat can significantly alleviate this symptom. If you experience persistent itching that does not resolve with topical treatments or allergy medications, a consultation with a healthcare provider is recommended to rule out liver health issues and explore appropriate treatments. 3. Low thyroid. Another sign that might indicate the presence of fatty liver is low thyroid function, or hypothyroidism. The liver plays a pivotal role in regulating thyroid hormones by converting thyroxine, T4, into its active form, triiodothyronine, T3. When the liver's health is compromised due to fatty infiltration, this conversion process can be significantly hampered, leading to symptoms of hypothyroidism. Clinical research, including findings from a study in the Thyroid Research Journal, suggests that there is a noticeable prevalence of hyperthyroid conditions in individuals with non-alcoholic fatty liver disease. The study reports that up to 30% of NAFLD patients may experience reduced thyroid function, affecting their metabolism and exacerbating symptoms related to both thyroid and liver health. Symptoms of hypothyroidism such as fatigue, weight gain, and cold intolerance may not be overt in the early stages, making them easy to overlook or attribute to other causes. However, the interplay between reduced thyroid function and liver health is significant and can influence overall metabolic health. If you're experiencing unexplained changes in weight, energy levels, or general metabolism, it's crucial to get both your liver and thyroid checked. Early medical intervention can improve liver function, potentially stabilizing thyroid hormone levels and alleviating the symptoms associated with hyperthyroidism. 4. Constant fatigue. Constant fatigue is another subtle yet significant indicator of fatty liver disease. This symptom goes beyond the normal tiredness experienced after a long day. It's a profound exhaustion that doesn't improve with rest. Fatigue in the context of fatty liver can be attributed to the liver's reduced efficiency in metabolizing energy sources, particularly glucose and fats, which are integral for energy production. Research published in the World Journal of Gastroenterology points out that patients with fatty liver often experience metabolic disruptions that affect their energy levels. The liver's compromised ability to regulate glucose due to insulin resistance, a common companion of fatty liver, leads to uneven energy spikes and dips throughout the day. Furthermore, as the liver struggles to filter out toxins and produce essential proteins, the body's overall stamina declines, leading to persistent fatigue. This type of fatigue can significantly impact one's quality of life, making even small tasks feel overwhelming. It's a sign that the liver, which plays a central role in energy production and detoxification, is under stress. If you're experiencing such unexplained and relentless tiredness, it's important not to overlook it as merely a lifestyle issue. Instead, consider a discussion with your healthcare provider to check for underlying issues such as fatty liver, which might be contributing to your fatigue. Early dietary and lifestyle changes can enhance liver function and help mitigate this fatigue, improving your overall health and well-being. 5. Right shoulder pain. Another less obvious but indicative sign of fatty liver disease is pain in the right shoulder. This particular discomfort can be misleading, as it often mimics musculoskeletal pain, leading many to seek orthopedic consultation. However, the real culprit behind this symptom is often liver inflammation. When the liver enlarges or becomes inflamed due to excessive fat deposition, it can put pressure on the diaphragm, the muscle under your lungs that helps with breathing. The diaphragm shares nerve connections with the shoulder, particularly the right shoulder, through the phrenic nerve. As the liver presses against the diaphragm, discomfort is referred upwards, manifesting as shoulder pain. Research highlighted in the European Journal of Gastroenterology and Hepatology notes that approximately 15% of patients with liver diseases report experiencing referred pain in their right shoulder. This is particularly noteworthy in individuals with a fatty liver, where inflammation is a frequent issue. Recognizing right shoulder pain in conjunction with other symptoms such as fatigue, abdominal swelling, or jaundice can provide critical clues in diagnosing fatty liver early. If you experience this type of pain without a clear cause, especially if other signs of liver stress are present, it's crucial to discuss these symptoms with your doctor. Early medical intervention can prevent progression and manage symptoms effectively. 6. Belly fat. Belly fat is more than just a cosmetic concern. It is a significant health indicator, especially when it comes to liver health. An increase in abdominal fat is closely linked to fatty liver disease, a condition where fat accumulates in the liver cells. This is not just about the fat under the skin, but also includes visceral fat, which surrounds the internal organs, including the liver, and significantly impacts its function. Research has shown that individuals with excessive abdominal fat are at a higher risk of developing non-alcoholic fatty liver disease. A study published in the Journal of Clinical Gastroenterology highlights that over 70% of individuals diagnosed with NAFLD have abdominal obesity. This type of fat is particularly dangerous because it produces inflammatory substances and hormones that can damage liver cells. The mechanism behind this involves insulin resistance, which is commonly induced by abdominal fat. Insulin resistance impedes the body's ability to manage glucose and fat, leading to increased fat storage in the liver. Over time, this can escalate beyond simple fatty liver to more severe conditions like steatohepatitis or even cirrhosis. Addressing belly fat is crucial for those at risk or currently dealing with fatty liver. Interventions such as dietary changes, increased physical activity, and weight management can significantly reduce the burden on the liver and improve overall liver health. If you're noticing an increase in abdominal girth, especially if it's rapid, it's advisable to consult with a healthcare provider for a comprehensive evaluation and tailored management plan. 7. Rib pain, costochondritis. Another intriguing yet often overlooked indicator of fatty liver is rib pain, specifically referred to as costochondritis, when inflammation is involved. This pain occurs in the cartilage where the upper ribs attach to the breastbone, an area susceptible to inflammation from various triggers, including strain from an enlarged liver. Research published in the Journal of Gastroenterology and Hepatology suggests that patients with fatty liver disease may experience abdominal swelling due to liver enlargement. This swelling exerts pressure on the rib cage and surrounding structures, sometimes leading to costochondritis. This condition can mimic the pain associated with more serious conditions like heart disease, which often leads to misdiagnosis. Costochondritis associated with fatty liver is typically characterized by a sharp, aching pain or discomfort in the ribs, particularly where the ribs meet the breastbone. This pain may worsen with certain movements that involve the upper body or deep breathing. If you're experiencing persistent or sudden onset of rib pain, it's important not to dismiss it casually as just a minor injury or typical body ache. Considering the potential link to fatty liver, especially if other symptoms such as fatigue or abdominal swelling are present, seeking a medical evaluation can be crucial. Timely intervention can help manage symptoms effectively and prevent further liver damage. 8. Spider veins, angioma. The appearance of spider veins, also known medically as angiomas, is a less commonly known but significant indicator of fatty liver disease. These small spider-like networks of blood vessels that can appear on the skin are not just cosmetic concerns, but may signal deeper metabolic and vascular issues, often associated with liver dysfunction. According to research in the American Journal of Clinical Dermatology, spider veins are prevalent in individuals with advanced liver conditions because of hormonal imbalances caused by liver dysfunction. The liver's impaired ability to process and break down hormones like estrogen leads to higher circulating levels, which promote the growth of vascular structures like spider veins. These tiny red, blue, or purple veins typically develop on the face, neck, and arms, and are particularly visible in individuals with fair skin. While they are generally harmless, their sudden appearance can be a prompt for individuals to evaluate their liver health, especially if other symptoms such as abdominal swelling or fatigue are present. Diagnosis of spider veins involves a simple visual inspection, but understanding their cause, especially in the context of liver health, may require blood tests and liver function studies. If you notice an increase in spider veins and are concerned about your liver health, discussing these changes with a healthcare provider can lead to early intervention and management. Recognizing spider veins as a potential sign of fatty liver encourages a proactive approach to health, urging those affected to seek medical advice and potentially uncover underlying health issues sooner rather than later. To wrap up, recognizing these signs early on can be vital for addressing fatty liver before it progresses. If you notice any of these symptoms, consider consulting with a healthcare professional for a thorough evaluation. For more insights into managing your health, don't forget to like, subscribe, and click the bell icon for updates on our latest content.